my name is Lisa Blythe. I am International Business Developer and Relations Manager for the Air Quality Modelling team at Vito. I don't know if you all know who Vito is. They're one of the co-organisers of this conference. So we're a Flemish RTO research organisation in sustainability. But this topic today is mostly about, as I said, advancing air quality and pollen and human biomonitoring. And as we all know, I think 28% of the disease burden in Africa is due to environmental stressors. So it's very important that we have very good data that can give us information on what actually are the health impacts. And I think air pollution is probably also one of the top 2, 3, 5 of the key health concerns also in Africa. So I'm hoping that the presentations today, that we get a little bit more evidence, and I'm looking at the speakers, on what's happening on the ground, what kind of data are we getting, where can we make advancements in the future. We're going to have 5 presentations here. We're going to have 1 remote, so we have 6 presentations. I've asked everyone to kind of keep them short, about 12 minutes. So we'll have about 15 minutes at the end for questions. So if you have any questions, if we can wait till the panel session, I'll invite everyone back. We have 2 microphones, so please don't be shy. Please note anything. And if you have any questions at the end, we'll take them. So I won't take any more time. So the first speaker is Kama Jetty from the South African Weather Services. And he's the Senior Manager for the Air Quality Services. So thank you.
Hey, good morning, everyone. Like Lisa indicated, I am from the South African Weather Service. Often get asked about the weather, but I'm not involved in any of the weather efforts at the South African Weather Service. I'm responsible for air quality services, and basically that involves the management of the priority area networks. So in South Africa, we have designated 3 areas as priority for the management of air quality because of the poor air quality in those areas. So we manage those monitoring networks and we report on the data to government. And I'm also responsible for the South African Air Quality Information System. If you are not familiar, you can obviously check it up on the web, or you can download our app and you can access information through the app. It's available for all platforms, Android and Apple. Okay, so my presentation is going to be on the integrated community level pollen and air quality monitoring network for South Africa. It's still in its infancy, our efforts. So the reason we got into pollen, and many will ask whether this is a mandate of the South African Air Quality Service, and it's been a difficult one to justify, but there is a significant burden on South African population as far as the impact of exposure to air pollutants. We have about 21 million people suffering from allergic rhinitis, and then there's another 6 million of those that are affected by asthma. We've also managed to quantify our burden due to exposure to PM 2.5, and we equated that to approximately 42,000 premature deaths. And there's obviously a cost attached to that that's also significant. In terms of there being no publicly funded monitoring strategies or data available for pollen and fungal spores. So currently our efforts regarding air pollutant monitoring are funded by government, so our data is freely available. However, in terms of pollen, there's no agency of government that is pursuing the collection of the data, probably because some have not identified with the relevance or significance in the space. But there's also another aspect around modeling, where the biogenic emission inventories are not developed for our country. And there's no way of verifying whatever effort is currently underway in terms of modeling or estimation of those emissions. Okay. So if you don't understand the relationships that exist between pollen and air pollutants, this would help a bit. I'm not going to go into all the detail, but basically, when there are high levels of pollutants in the atmosphere, it has an impact on pollen, and it modifies the grains, making them more allergic. And then it also potentially leads to more severe allergic reactions. And in terms of pollen, it also causes symptoms like sneezing, runny nose, itchy eyes, and coughing. And it can also exacerbate those existing conditions that present in the population. So what we wanted to do was establish a network of air quality and pollen monitors, but coupled with that, we included the METs. So we have wind speed, wind direction, temperature, rainfall, because all of those affect the presence of pollutants in the atmosphere, and it also gives an indication of origin. And ultimately, we wanted to provide real-time data to support health warnings, air quality and pollen forecasting, and then to use the data that we collect to further research in the space and for informing policy development. We also wanted to support climate change adaptation via availability of improved environmental data and to facilitate the empirical validation of Earth system models. Just as a way of introduction to the pollen monitoring technology, this is the traditional method. It's a Burkhardt trap. Basically, there's a strip that rotates at a certain frequency, and it represents 1 week of sampling. And we remove that tape, and it's sent to a lab for analysis by an aerobiologist, and they basically count the different types of pollen on that strip. What we've also acquired is the latest and, let's say, greatest technology, which is the pollen sense. It's an automatic sampler. There's a camera inside this device, and including a tape cartridge. So basically the tape advances based on the saturation on the tape, and then the camera takes images of whatever pollen's on that tape. It then sends those images to the AI, and the AI identifies the pollen grains based on a pollen library that exists in the US. So what we're currently doing is trying to build our own pollen library to improve the AI ability to more accurately identify the pollen grains. This is supposed to be animated, but basically this is a traditional air quality station. It costs in excess of 3 million rand in our money, or South African rand. It is not something that we can afford easily. So what we decided to do, to look at more low-cost equipment or research-grade instruments. So we acquired this particular device. It's called SkyGauge 1. It has both the MET, the air quality, and the pollen monitoring capability in it. And these would be rolled out in our second phase. So our first phase of the project, we're basically doing the intercomparison to verify the performance of both the traps. What does that mean? Okay, so is that me? Okay, now Lisa, your computer. Okay, so the benefits of the system, I'm hoping, I'm not going to go through everything, but it basically, we wanted to strengthen our public health resilience and provide environmental intelligence and climate preparedness in Africa or South Africa. There's also the aspects around positioning us to respond to current health challenges, anticipate future climate-related risks, and deliver on our mandate. Our network currently, we have 6 instruments that are positioned strategically across our country. They are in Cape Town, Kimberley, Bloemfontein, Ermelo, and Pretoria. So Cape Town here, the rest are in the north part of the country. We're in a phase where we want to expand to the additional areas. We need to put out 27 traps. And in phase 3, we're hoping to have this type of coverage in our country in the different biomes and in certain high-risk communities. So some of the products we intend to provide to our communities and to business. So it is, as an example, a product list of pollen heat maps, and these are typically what you see here. And then there's the forecast, also similar output to give you an indication what the pollen would be like in the next 2-3 days, in the next day, or even shorter periods. And then obviously the data. So the data is used by the medical profession and others, even research, to understand how people are responding to their exposures and also to treat. So at some point, we want to be able to provide the business to client solutions, which are here, the personalized pollen alerts. So if you have a mobile device and you're subscribing to our service, it will alert you in terms of pollen levels being too high in the atmosphere. So you try and limit your exposure, or you take your meds and so on. And then also there's symptom tracking on that capability that we have. And then with the UCT Lung Institute, we are working on the treatment options and so on. So that device will be, or the solution will be set up so that it's customized for South Africa. Okay, so the climate modeling benefits are fairly detailed. So we're looking at positioning ourselves to be able to validate biogenic emission inventories in Earth system models. We want this process and the data to help us calibrate atmospheric models using actual pollen and VOC emission data. It will also contribute to improving our understanding of seasonal and spatial pollen variability linked to vegetation, climate, and land use changes. It will enhance our forecasting capabilities for both air quality and climate risk. And then we're looking at improving collaboration in the space with different players. And I think the technology provides a lot of opportunity for innovation. And it also is the first attempt from us to actually work with mainstream AI to improve our monitoring efforts. I won't go through all the detail here, but I think I've emphasized the public health protection benefits, the awareness and behavior changes, and the climate change adaptation. Because of time, these presentations will be made available to you. You can look in detail. There are some risks. We do have a shortage of aerobiology skills in our country. So there's a lot to be done in terms of improving those skills. There's limited, there could be limited user uptake of the app. Our initial tests indicate that there are people that would really benefit and are looking forward to using this type of solution. But in terms of all the costing models, we need to achieve a certain number to ensure that this network can be sustained into the future. So it's important that we can recover the cost of continuing these networks. It's pointless establishing it, running it for the projects that we have over a 2 or 3 year period, and then it falls off. So it's important to set up the business to consumer system that it works for everybody and is affordable, and the subscriptions are possible. Delays in data system integration. Locally, we do have our challenges with infrastructure, but the solutions and our partners are in the US. So at this point in the project, we are not so worried about it, but there may be drive in future to bring all these systems into our country. So there could be also costs related to that. The climate and related disruptions, floods and power cuts, those are normal. We have load shedding in South Africa, and because of international participants, I'm not sure if everyone knows about it, but they manage the grid by cutting off power to different areas, so it does affect us. And then, if I can move on, I got 1 minute. The challenges currently between the manual system and the real-time sensing. So this is typically what one would see on a microscope that gets analyzed by aerobiologists. This is what we're seeing through the automatic sampler. So the images and how the AI identifies it, is, you can see, depends on the image library. So between the two, there's a huge difference. So we're trying to work on improving the AI capability to identify. And then between the strips and the Burkhardt, you got about a 50 centimeter strip. And then coming out of the automatic sampler, this thing, if you unroll it, it's about 2 meters or 1.8 meters for a week. So we're trying also to find a way to relate the measurements and compare the accuracy between the devices. And okay, funders, I think there's a long list of funders, but definitely a network like this, if it's currently not supported by environmental funding from government or health funding, we're looking to get partners from different sectors. And collectively, between the Weather Service and the UCT Lung Institute, we've applied for funding to some of these partners, but we're hoping that the future we will be able to secure funding from more people that come on board, even the private sector. And thank you. Hopefully I kept time.
So asthma, Carmen did touch on this a little bit, but I'm going to focus on children, and I'll explain why towards the end. So asthma is South Africa's leading cause of childhood respiratory burden, affecting 10 to 15% of children in South Africa. And interestingly, we rank among the highest asthma mortality across all countries. The table on the right, or I guess the figure on the right, is low middle income countries in specific time frames, so 2001 2005, and then again 2011 to 2015. And you can see we are among the highest, with only the Philippines and Fiji having a higher mortality. In the kids in the country that are experiencing asthma, 20 to 30% of them will have severe asthmatic symptoms. And interestingly, asthma is also more common in boys, and then as the kids get older, the females, the girls tend to also develop asthma. Underdiagnosis is very common here, and as of course you can see, based on our mortality statistics, undertreatment is a significant concern. So even when we make the diagnosis, treatment is often inadequate. So asthma is driven by basically sensitivity to your environment, and that can be lots of different things. We at the Lung Institute, we focus on aeroallergens. So basically that just means things that you're allergic to that are in the air, aeroallergens. And we group these into 4 different categories. So that's animal derived, so that might be your cats and your dogs. Fungal spores, that includes mold. Microbial particles, so that's things like viruses and bacteria that are in the air. And then lastly, plant derived particles. So that's the pollen that comes from the trees, the grass, the flowers, and so on. And you can see based on the graphic here, this was a South African study done to understand what we're sensitive to. And aeroallergens that are plant-derived make a significant amount of the risk and the things that are driving asthma exacerbations in the country. So how is pollen monitored? Carmen's already gone through this, so I won't go into any more detail, but Burkhardt monitoring, which is the picture here, is our gold standard, and we are hoping that the pollen automated monitoring will come on board because of the extreme labor-intensive methods that we need to use to be able to actually monitor pollen in real time. So when we have the pollen data, what do we do with this information? So the Allergen Immunology Unit, which was established 25 years ago, has a focus on allergic disease and chronic immunological conditions. And essentially, the AIU is running the South African pollen monitoring network. And so what we do is we do environmental monitoring across the country. I'll get into that in the next slide. And what we do with this information is we use it to inform treatment for our patients who have allergies, who are asthmatic, allergic rhinitis, and so on. And this information is also made available to clinicians across the country and those that are interested on our website. And this allows us to mitigate to some degree asthma exacerbations. So we might add treatment before the pollen season starts to reduce exacerbations. We might increase doses of medication to help our patients manage their disease. And then lastly, we also use this to educate our patients. So if patients have undergone some kind of testing to understand what they're allergic to, they're then able to use that to understand this time of year, this is the risk that I'm exposed to. How should maybe I modify my treatment? If I'm a runner, maybe I don't compete in marathons in pollen season. So this really gives our patients tools to manage their own disease as well. So the South African Pollen Monitoring Network, as Karma has said, is largely funded on good vibes, and the pharmaceutical industry has been sponsoring a couple of traps around the country for the last few years. So this network was somewhat formalized in 2019, and it's managed by the Lung Institute. We have universities across the country who are participating by managing the traps and doing some of the reading of the pollens, the strips. At the moment, we actually have 6 years of uninterrupted data, which is really great, and we've managed to have that continuous monitoring across South Africa. We currently monitoring about 8 to 10 cities across the country, which obviously means that large parts of the country are not being monitored. And this data is available on our website, the Real Pollen Count, or pollencount.co.za. It's updated every week on Friday, so this gives people across the country a real-time sense of what their environment is doing, whether their risk is high or not, and that allows them to tailor their treatment. We also have pollen calendars, and this was actually one of the great things that's come out of the last few years of us doing this uninterrupted, continuous monitoring across the country. And this actually comes from this publication, which came out a couple of years ago after our first 2 years of monitoring. And this allows us really to kind of characterize each city and what the risks are, what kinds of pollen are in the air. These pollen calendars are also available on pollencount.co.za. So again, that allows clinicians and patients to have this information and support their treatment options. It's important also to note that obviously climate change is reshaping pollen exposure. If pollen is a significant concern, how the climate's impacting pollen becomes our concern as well. Karma's gone through this, so I won't go into too much detail again, but basically increased heat will drive pollen production, increased allergenicity, rainfall drives flooding, obviously, and dampen mold. And when it rains, the pollen actually swells, and that results in it rupturing. And the things that are inside the pollen, the proteins that are inside the pollen, are actually what you're allergic to. And that can drive exacerbations. Wind will obviously pick up pollen that's actually already settled on the ground and put that back into the air, and therefore increase your risks. In terms of air quality, pollen can actually interact with or bind with gases and particulate matter that can make it more potent, that can make it more irritating when you breathe it into your airways, which can obviously worsen asthma, and also when pollen can bind to particulate matter in the air, and that allows it to be carried further away. So this takes us to SA CARES, which is the South African Climate, Air Emissions and Respiratory Health Early Sensing Project. It's a big mouthful, so we just call it SA CARES. It's a Wellcome-funded project that was started in January this year and will run for the next 3 years. And essentially what we wanted to do was we wanted to look at children in communities across South Africa and really understand what they're exposed to and how that impacts their health. So we've selected communities which have different vegetation across South Africa. We call them biomes, and also to some degree varying in terms of their exposure to different things. So some of these are urban, some rural, some peri-urban, with different also socioeconomic structures. And this is essentially the model for the study. So what we're doing is we're taking asthmatic children and we're seeing if we can link them to community healthcare utilization. So we call this a sentinel model or a sentinel surveillance. So we want to understand if we're monitoring just a couple of kids in a community and they develop asthma and they end up in the hospital, does that mean that the community as a whole is at a risk of having increased hospitalizations, and driving like increased healthcare utilization, which means we might be able to, if we prove this, we might be able to then put early warning systems in place. So that might mean healthcare readiness, so increasing beds or ICU staff, and so on. This might mean the community warnings, which is what Carmen was talking about. So having apps, having alerts go out, recommending decreased outdoor activity or things that are exposing our patients, as well as also medication access, and making sure our inhalers are in stock, steroids are available, and so on. So what we're really doing here is, in terms of these kids, what we want to do is we want to map their exposures across the community. So we're mapping this at 3 levels. So we're doing personal monitoring, we're then doing household monitoring, and then also community monitoring. And we want to really understand their whole environment. So we're looking at their pollen exposure, we're looking at their essentially weather, meteorological data exposure, so temperature, humidity, and then we're also looking at air quality and gases, so particulate matter, and some gases that are known to exacerbate asthma. So that's all of our meteorological data there, bioaerosols and air quality. And we're linking this to their health, so we're doing very intensive monitoring on these kids. So we're going to be doing lung function testing, inflammation testing, understanding exactly what they are allergic to as well, and then tracking their symptoms over time over the course of 12 months. And then hopefully we will also then be able to look at our healthcare utilization for the community. In the course of setting up the study, we've also come to the realization that data on healthcare utilization in communities is significantly lacking. Public versus private data is siloed. So if we are looking for private data like medical aids that might have data on asthma attacks, medication, ER visits and admissions, that data is available, but it is siloed within the private healthcare institutions, and we need to set up contracts and so on to be able to access that data. In the public space, actually a lot of that data isn't collected. So it's not that we can't access it, it's actually that it doesn't exist. So there's a big focus on infectious diseases in South Africa, but non-communicable diseases like asthma are currently not really very well tracked. When we do have this data, so the Western Cape, I think, has started taking some steps towards tracking this in more detail. The data is of a fairly poor quality. ICD-10 codes are not really applied, so it's going to require a lot of effort to actually make this data usable, to understand what it's telling us and so on. And then reporting. If we're ever going to look at forecasting models and so on, we need to be able to access this in real time. So a lot of the data, we have significant lags in being able to access the data, in that data being collected, being recorded, being made accessible on any kind of platform. So these are all kind of the gaps that we need to address, and we're hoping to address at least some of these in our study, because obviously it's a controlled environment. We will be collecting all the data on our participants, and hopefully we'll be able to make recommendations to our government and how they might be able to include non-communicable disease tracking in the frameworks that are currently existing. So essentially, take-home messages is that bioaerosols, weather, and air pollution interact to increase climate-sensitive disease risk. South African Pollen Monitoring Network, or SAPNet, has built the foundation for aerobiology surveillance or air allergen surveillance. SA Cares is a study to integrate all of this environment and health metrics into one study. And really, looking forward, we need more cross-collaboration to develop and expand respiratory surveillance in the country. Thank you.
Now we have our speaker that's joining remotely from Flanders from the Environmental Health.
Okay, good morning, everybody. Thanks to the organizers for letting me sharing our experience in Flanders. I'm Karen. I'm the Unit Manager Environment and Health within the Flemish Department of Environment. And I want to share with you our 20 years experience of our Flemish Environment and Health Studies FLESH. So I come from Flanders. It's a northern part of Belgium, mainly Dutch-speaking and fairly modest in size. It's a densely populated area and a combination of metropolitan municipalities like Johannesburg, Tshwane, and Ekurhuleni could collectively resemble Flanders in terms of population density and economic activity. At the end of the 1990s, Flanders struggled with several local pollution issues like a dioxin crisis in food items, health problems surrounding an incinerator. So a lot of problems popped up, and in response to that increased public concern about the environment and health, the Flemish government started with the Flemish Environment and Health Studies, named FLESH, in 2002, and they are based on a human biomonitoring program. Human biomonitoring is the systematic measurement of chemical substances and or their effects within the human body using biomarkers in samples like blood and urine. So what is FLESH about? We made a very nice movie, but I don't have enough time to share it with you, but I put a link here, so maybe afterwards you can check out our movie. So we started with our FLESH campaigns, and it is a 20 years of transdisciplinary collaboration between science and policy. And it has different aspects. It's a program for all our Flemish citizens. It has some very important leading principles. We try to apply the exposome approach as much as possible. It's a base for historical, current, and future policies, and we apply the state-of-the-art research. And I will go through with you in all these aspects in the following slides. So, FLESH, it's for all Flemish citizens. So we started in 2002 with our first cycle. Now we are in performing our fifth cycle, and we addressed different types of areas in Flanders. We combined different hotspots regions in Flanders in combination with reference values for all Flanders. We studied also specific behavior aspects like behavior, environmental friendly behavior, and we also in the last cycle study association with characteristics of the living environment. We also have different age groups ranging from newborns to adolescents, adult people and elderly. And in the two last cycles, we also align with the European programs HBM4EU and PARC. So maybe some facts and figures. Up to now, we included almost 6,500 Flemish citizens in our FLESH studies. We also have a biobank with extra blood and urine samples. Up to now, we have 46,000 samples in the biggest biobank of the healthy Flemish citizen. As I told you, I have 4 age groups included. And what is important here is that we continuously put extra effort in including participants with a lower socioeconomic status in a representative way. If you want to study the impact of the environment on health, it's essential to include participants of lower socioeconomic status. Our leading principles. We have, as I told you, a center of expertise on environment and health, and it's a collaboration between all Flemish universities and research centers, PH and V2. So it's a co-creation of knowledge based on interdisciplinary research, and it includes epidemiologists, toxicologists, food scientists, but also social scientists, chemists, medical doctors, spatial planners, and so on. We have a steering group where we make all the important decisions with the representation of many policy departments. The departments on environment, on health, on science, innovation, on education. They closely work together, and in this way we try to apply health in all policies. We have yearly working plans, and the reports are approved of the cabinet of our Flemish Minister of Environment, so we have all the time political support for the work done. We involve stakeholders from the beginning on in the problem formulation, but also when the results are there in the policy translation of our results. And this participative way of working is essential. All our participants always get their personal results first, before policymakers, before the stakeholders, before the general public. We really take care of our participants, and the follow-up care of the participants is essential. We have personal consultations with the study doctor. We have fact sheets for every biomarker of exposure and effects. We have personal preventive healthcare advice to minimize exposure. We also try to apply the exposome approach. So we apply different, or we include different factors in our study. Spatial factors like land use, food environment, population density, lifestyle factors like physical activity, diet, smoking and drinking behavior, social factor, the socioeconomic status, but also mental resilience and well-being is being studied in our study. And of course, the physical-chemical factors like noise, air pollution, diffuse soil contamination, water pollution, we all try to integrate it in one study. So if you see, when we started in our first cycle, FLASH 1, we had like 28 biomarkers of exposure. We are now in the middle of our fifth cycle, and I can tell you that we are now having more than 200 biomarkers of exposure. We have the different age groups, which are divided over the different cycles. And we also have an evolution in the influencing factors. In the beginning, it was mainly focused on the sources of pollution. But in our current study, we also include climate change, biodiversity, annoyance, and food environment. And also we have an evolution in markers of health effects. We focus now on a broader set of early markers because our study is really dealing with preventive policy. And we also have attention to mental health. All these data are meant for policy. It's not only measuring for measuring, but they have to be the basis of concrete policy measure. So after every cycle of our FLASH study, we interpret results and we define policy options. We prioritize the policy options, and at the end, we make a policy choice and we have concrete policy action plans. We assess different criteria for prioritizing, like health risk, policy feasibility, and social aspects. And we do not do it on our own, but we include even more scientists, policy experts, other experts, and even our participants, stakeholders, schools, action groups are there for performing with us the prioritization and the policy translation. So here I have some concrete policy measures which we're taking based on HBM results. We had an optimization of the existing Flemish legislation in open fires. We have also special campaigns of awareness raising and collection of DDT and other forbidden pesticides for waste disposal. We optimized our environmental monitoring programs. So up to now, we do not only source-oriented measurements, but we also perform measurements in background areas or in residential and agriculture areas. We have sensibilization campaigns on outdoor and indoor stoking and wood burning. We have good practices and information website for cultivation of crops and act in public garden. So a lot of different policy actions were taken. Also for PFAS, you know that PFAS, we're dealing with a lot of problems within Flanders with PFAS contamination, and our HBM results on PFAS are actually the initiator of our first PFAS action plan in 2020. We could measure PFAS concentrations in all our participants in the 4 different age groups. We saw correlations with different biomarkers of effect. We had exceedance of different health-based guidance values, and we had possible uptake of consumption of own-growth food, and we had a link with soil contamination. So all these were arguments for policy development. And in 2002, a reinforced PFAS action plan came into practice. Within that action plan, we had a dedicated action on a hotspot HBM program for policy evaluation. We also want to have a monitoring or a research program which is using the state-of-the-art research. FLESH has been involving citizens and society in scientific research for policy for more than 20 years now, but it has been a major challenge. When you want to monitoring the complex exposure and link it to health, we need to engage and also in the future even more on a larger scale. So for the moment, we are looking into self-sampling methods to enlarge our scale. We want to apply the exposome approach, and it calls for new technologies. We want to have interactive and online monitoring, sensors for certain personal health parameters, sensors for indoor air measurements, and so on. We also looking into new chemical methods like non-target analysis, methods for measuring microplastics, and we want to also include new models and indicators like exposure to green-blue spaces and nature to link it with health. Also, we want to have that broader scope of well-being, One Health and biodiversity and climate change, and that all calls for state-of-the-art research. So I put here for more info, you can have different websites. You can contact me. I will be happy to give you more information. The time was too short to go into details. And like I told you, it is a transdisciplinary collaboration between science and policy. We have a lot of departments, university, science centers included, a lot of participants and stakeholders, which I'm very grateful. Thank you for your attention.
Thank you, Karen. I hope you join us later on when we'll have the quick session at the end.
I will, thank you.
Okay, good morning. I'm Hamid Hassan. I'm epidemiologist by training, and I'm a researcher at Vito. Today, I'm not going to show you some kind of results, but you see how much HBM is really important for policy. And now my presentation will be the need for addressing research gaps in environmental health, the need for human biomonitoring programs in Sub-Saharan Africa. As we see, 1 in 4 disease burden is attributable to unhealthy environment. When you say unhealthy environment, it's like including air pollution, chemical contaminants, and so on. 12.8 million deaths worldwide are due to environmental exposure, which is almost 20% of the total global mortality. 14.4% of disability-adjusted life risks are also due to environmental exposures, and this burden is expected to double by 2050. The major causes are air pollution, chemical exposure, and also climate change. And when we see this burden, Sub-Saharan Africa is disproportionately affected by the environmental burden. You can see here from a result from the Institute of Health Matrix from Washington University. So in total, you can see that the burden of environmental exposure is really high in Sub-Saharan Africa. There are a lot of environmental challenges in Africa. For instance, agricultural practices, the use of pesticides that are might be banned also like 10 or 20 years ago in Europe or in the US. Rapid urbanization and also industrialization leads to a lot of chemical pollution, mining activities, household air pollution, and inadequate waste management are among the challenges in Sub-Saharan Africa. So why HBM? Karen gave some kind of background what HBM is. It's just monitoring of exposure internally, not only from the external point of view, but how much people are really exposed internally. So there are remarkable advancements in environmental health research in the last couple of decades. There are improved methodologies, enhanced analytical techniques, and increased interdisciplinary collaboration. And HBM is one of the most important advancements in environmental health because it measures the actual internal human exposure level. It also helps to investigate exposure routes, toxicological process, and also the possible health impacts. It's also very important to identify high-risk groups for targeted intervention, and it tracks trends over time to evaluate whether the policies that are making are effective or efficient or not. So since then, HBM or human biomonitoring is becoming a benchmark in environmental health research. For instance, the US National and Health Nutrition Examination Survey, they already included the HBM program as part of the NHANS survey starting from 1999. The Canadian Health Measure Survey is already started since 2007. HBM programs are in several European countries like Germany, France, Belgium. You already see the Belgium HBM experience starting from 2002, and Czech Republic. And this has been running for more than 3 to 4 decades in those countries. And recently in Europe, there are initiatives to harmonize these HBM programs even within Europe, including HBM for EU and also the PARC project. Australia, Korea, and China, they are always using the HBM as the most important environmental health program. But there is a research effort gap. Human biomonitoring initiatives are really limited in many African countries. The region faces like a shortage of research infrastructure, skilled personnel necessary to implement HBM programs. A brief literature review showed less than 30 HBM studies in Africa, and all those studies are really pilot. There is like a kind of monitoring program in South Africa, but the focus on internal exposure is really very limited. So the majority of these efforts are focused on contaminants like heavy metals and mycotoxins, and these are preliminary, which is very small sample size and very difficult to monitor the exposure across time. And all the results suggest that the exposure to certain chemicals, including metals, pesticides, is very high compared to Europe and also other high-income countries. So all research highlights the critical need for consistent and comprehensive biomonitoring programs in Sub-Saharan Africa. So what key focus areas could be? Maybe highlight the significance of HBM program, assist authorities in developing and implementing HBM initiatives, enhance public understanding of environmental health hazards, recommend preventive measures to promote healthier communities, strengthen research capacities and also infrastructure, both human capacity to do the HBM program, and prioritize efforts in resource-constrained high-risk regions within Sub-Saharan Africa. Currently, what are the VITO's HBM activities? VITO is currently engaged in human biomonitoring research across Europe. As you see in Karen's presentation, VITO is involved in the Flemish biomonitoring program. Mainly, we focus on biomarkers for exposure and also biomarkers for effects. We are working on workflows for HBM data management and analysis from a different perspective. We are also involved in assessment of risks and health impacts. There are initiatives to measure from internal exposure to health impact. Instead of like measuring, oh, the PFAS level is this much. Okay, what are the monetary value of that exposure. Now, recently we are doing some activities in Europe to quantify the amount of exposure for different chemicals in terms of health impacts, in terms of loss of dalis, in terms of loss of also money. And we are also working on development of innovative tools to support decision making, from exposure to decision makers or policy makers. But the majority of these partnerships of VITO are mainly concentrated within Europe, and we are like seeking collaborative networks to enhance HBM efforts in Sub-Saharan Africa. So this is our call for action. We need to strengthen HBM programs in Sub-Saharan Africa through shared knowledge and also collaboration. We need to invest in capacity, in infrastructure, and also technical expertise. We need to unite governments, researchers, and international partners to advance chemical risk assessment and protect public health in Sub-Saharan Africa. Thank you, and I'll see the question for after the presentation of
Yes, thank you very much. I'm a bit the odd one on this panel. I'm a social scientist, so I'm going to try and change the perspective a bit of what we're talking about. I'm an anthropologist working at KU Leuven in Belgium and Ghent University. And besides that, I'm also coordinating GSTIC, which is an international stakeholder network working on air pollution and chronic respiratory diseases on the African continent. It's a partnership between various European universities, but also African universities. We are quite young, only a few years old. And the project I'm going to draw my presentation on is one of the projects executed by the GSTIC stakeholder network. Today's focus is not really to present any results, but rather to guide you through a question that I hope we can take up either during the Q&A or later on today during one of the breaks, on how to design more inclusive data structures that actually merge big data coming from census with what we call thick data coming from more anthropological insights. So what is the project about? It's called AI and Citizen Science for Climate Resilience in Nakuru. It's a partnership between, or collaboration between Egerton University in Kenya and KU Leuven in Belgium, and is funded by the government of Flanders via the Flanders International Climate Action Programme. The local collaborators on the project are the Kenya Meteorological Department, Census Africa, which is an initiative of Code for Africa, Nakuru County and City Management Offices, the Stockholm Environmental Institute, focusing on the policy aspect from the Nairobi office. And then we also collaborate with Voices That Count. Steph here from Voices That Count is present. It's a Belgian NGO focusing on citizen science methodologies. And then also the Belgian company XYZT.ai that is specialized in data visualizations. The goal of the project is to develop an AI-driven early warning system for air pollution that combines both big data, sensor data, with thick data coming from what we call a human sensor network and narratives about perception of air quality at the level of the various neighborhoods of the city. So this slide is kind of an overview of the data flows on the project. As I said, we try to combine quantitative sensor data with qualitative citizen-generated data to kind of improve the accuracy and the social relevance of our findings. We use ground-based sensors, low-cost sensors, produced by Census Africa. We have around 25 at this point that are installed across the various wards and neighborhoods of Nakuru, and they are calibrated against a reference monitor that is installed at the meteorological department in the city. We also use satellite data coming from the Copernicus Sentinel-5P satellite that provides additional data coverage. And then, and that's what I'm going to delve deeper into today, we have our human sensor network, which are basically citizen science, citizen ambassadors that use a data logging app to record narratives, observations, and experiences of air quality in their various neighborhoods. We then feed all of this, not yet now, but in the future, in the near future, into machine learning models that then produce predictions. And the outcome should then be an AI-powered early warning system for forecasting that monitors air quality in real time, but it remains grounded in the lived experience and in the local experiences of the citizens in the city. So let me skip this. Oh, I've added this QR code because we have some videos on the project that are on the project website. If you scan that, you go to the Spira website where we have a project kind of overview and some videos as well, but there's no time to show them today. So what I want to do today is kind of delve a bit deeper into the knowledge foundations that are behind these two modes of producing knowledge on air quality, either big data or thick data, anthropological data, and what the assumptions are about interpreting the world as it is and air quality as it is behind these ways of measuring. So big data, to start with, the ambition to make air legible through big data builds on a longer history of meteorological and environmental quantification that first took shape, at least for Kenya, in the mid-20th century. So in Kenya, weather and climate observation, at larger scale at least, were initially gathered to serve plantation economies. Think about the tea and coffee plantations in Kenya. In this context, data on rainfall, temperature, and atmospheric circulation emerged as political tools for governing both land and labor. So such measurements operated under the assumption of a global or planetary horizon, and I don't know if there's anyone who knows what the right picture is all about. I mean, you know what it is, but what the context of the picture is. No? It's the Earthrise picture taken by astronaut William Anders during the Apollo 8 mission on December 24th, 1968. And it depicted for the first time ever the planet as this kind of fragile, self-contained sphere that unites one universal humanity. And it led to the start of the environmental movement, with shortly after then Yellowstone National Park in the US. But contemporary technologies, it produced a kind of a mode of global observation that then led eventually to the acceleration of Earth system modeling that looks at the planet from above and that is rather detached from the lived realities on the ground. So these contemporary technologies that we use today, like satellite imagery, but also remote sensing, exemplify well this kind of epistemic stance, way of producing knowledge from above, rendering air visible through standardized numerical readings. Think about PM 2.5, PM10, mapped as color-coded pixels, right? Heat maps that average pollution as grid cells, covering a certain amount of square kilometers, or in the best case, a certain amount of square meters. But this kind of measurements gained authority precisely because they are comparable, scalable, and predictive, and therefore the perfect tools for policymakers, right, and funders, because they can make decisions based on thresholds, trends, and probabilities. And that's good. But anthropologist Appadurai calls this way of measuring based or grounded in a probabilistic ethics. And central to his argument is actually that we must attend also to the cultural work of imagining futures that go way beyond probabilistic models to produce insights about how the future might look like. So in the context of air quality, this means actually recognizing that citizens interpret dust, smoke, or changing skies, for that matter, to more sensory, moral, and social imaginaries, or registers, that add social and cultural depth to the numerical values captured by senses, right? So back to our project. And that brings me then to the second part on thick data or more grounded experiential knowledge. So in Nakuru, what we're trying to do is bridging these kind of scales by combining the large-scale precision of sensor networks with the more grounded and experiential knowledge that citizens contribute to our data pool. And we do so, we call this initiative, first of all, Anga Watch, and Anga is a reference in Swahili to sky or atmosphere. And the idea behind it is to have a network of human sensors, citizen ambassadors in various neighborhoods that provide us with socially and culturally thick knowledge about their their experiences with air quality at the level of the neighborhood. And that then complements the big data from the sensors we've installed. So the core idea is that every sensor reading also tells a story, and we need to capture that story. Our neighborhood ambassadors collect top-of-mind narratives. So we don't really delve much into detail about their experiences. We basically just ask, how do you experience the environment, or how do you experience air? And I could delve deeper into the difficulties of translating that into Swahili to begin with. But so this gives us top-of-mind narratives. So the focus is not on whether the collected narratives are factually correct, but on how people perceive air and air quality in general. So we collected almost 1,000 stories by now. What came out during the example I'm going to give now is one of the early analyses that we did, is that we noticed, among other things, that there are interesting linguistic and sensory differences in how people perceive the air quality. In the English responses, the emphasis was more on what we can see, visible signs that can be pointed to and described from a distance. And these examples on the slide show that. In the Swahili responses, however, we saw more embodied and effective ways of registering what was going on. So basically, this example, short example for the sake of time, shows how these narratives reveal how people sense, interpret, and live with air pollution in very situated ways, and how language as a frame of reference, right, is important to take into account and make sense of how air pollution matters at the level of the community. The Swahili narratives privilege these embodied registers, while the English narratives privileged more what can be seen, the visual aspects. So the act of measuring from the point of view of the community becomes a deeply localized act, not from the planetary view of a satellite or the abstract position of a sensor in the city, but rather from the embodied and lived experience of heat. This leads me to the final slide with a set of questions I want to focus on. And that deals with the epistemic tension between, or the ways of knowing, and the tension that creates between these two modes of talking or analyzing air quality. So between big data and thick data. So AI-driven early warning systems, what we want to develop, they require data simplification, right? They work by reducing uncertainty to make models computable. But life is fundamentally messy. And so if you do that kind of data simplification, you flatten lived experience, whereby the situated and often contradictory knowledges, so not knowledge as a singular thing, but knowledges, become epistemically flat and do not really register the lived, local, messy and lived experiences of air quality. So there's a mismatch in scale, right? Your local insights from the citizen reports exist on an experiential plane, while universal models operate on abstract planetary scales with thresholds, probabilities, averages. So how do we balance this kind of top-down and bottom-up approach? What we try to do in our project is to reconcile the technical precision from sensors with citizen meaning-making. And why do we think that is important? It's because to ensure that community voices inform and not necessarily illustrate sensor data, right? So we work towards this kind of hybrid methodology whereby we combine narrative and numerical values, data streams within one interpretive system. We are not there yet. We are constantly fighting between the engineers and the social scientists on what the way forward is and how to code the data that is being produced and how to make it manageable and interpretable for our AI systems. So what the core of our project is about producing new epistemic infrastructures that respect difference, uncertainty, and multiplicity, rather than treating them as noise in the early warning system that we're producing. And so, to end, I wanted to focus on these two discussion points. How can we co-design data structures that respect citizen perspectives, and how can we scale then, these data interpretations while avoiding algorithmic bias if we scale things up and produce early warning systems. Thank you.
Okay, good morning, everyone. I'm Stijn Franks, one of the researchers in Vito's air quality monitoring and modeling team. I will be giving a short presentation on, back to the engineering and scientific point on air quality, of how we move from local air quality data to health impacts and local air quality actions, where we see where we see this use of the local data and how that can further strengthen the air quality knowledge and also raise the need for local action. Try to keep it short because of keeping time for questions from all of you and have a good discussion at the end. So first, it's of course important that if you want to go to air quality actions, that there is a shared goal and that you want to go somewhere, that you know what is considered locally sufficient quality of the air, what is an exceedance. Where it's important to be aware of the World Health Organization's guidelines of what can be considered clean air, where in Europe we now have the ambition to go to zero pollution by 2050. That's still quite some years ahead of us, but we also have intermediate targets. Many countries look at it in this way. And once you have set targets, then you can work to that target and see which actions are needed, which sectors need to contribute. And typically we look there at the more long-term averaging annual concentration levels and how we can meet these targets for the annual air pollution levels, as well as incorporating the short-term effects on hourly, daily levels for the different pollutants, where you here see the list with most focus in my presentation on particulate matter and nitrogen dioxide, but for the other pollutants it works in the same way. Okay, if we then have local air quality networks which can contribute to more insights locally, they can be combined with official monitoring networks where we might have quite sparse locations where we have really detailed knowledge on the local air quality situation, but only at a few locations. If you want to combine this with air quality networks, then some important guidelines that we always like to give is then which aspects should you look at in advance when you're building a network of sensors. Firstly, of course, you need to have a research question that you want to address. You need to decide, for example, which pollutant you're going to monitor. And from that, decide on which aspects are more or less important for a local air quality network. That also leads to some guidelines on when acquiring sensors. There are a lot of sensors on the market, and depending on the choices that you make, you should be well informed on what you're acquiring, how these sensors are performing. Some have very high uncertainties, some are very cheap, some are a bit more expensive. There are always pros and cons with acquiring hardware, and keep that in mind that you try to make the best decision to answer the research question that you have in mind. For example, from examples that we have in my home country, in Belgium, there have been in the past examples that people try to look at air pollution from traffic, but then they are using particulate matter sensors where the link with locally air pollution levels is not that big. It would have been better to look at different pollutants, and it becomes quite hard to identify the signal from the source you're looking at. So in that way, it's always important to well think ahead on what you want to measure. And then once you are installing the sensors and using the data, it's always interesting that you then link it to reference data from monitoring stations. They might not be available in some locations, but you could still install a sensor next to one of the monitoring sensors to have a good view on how is the sensor performing in your country, in the situation, the pollution levels, the weather situation that you have locally. If we then have data, then we can start combining it with other information that we have. There are air quality models that are available for global situation. local air quality models. Here I give an example for the country of Poland, where we're working on a project. There we take as a starting point the quite coarse Copernicus air quality model outputs, which we then start interpolating to a higher resolution and start combining with data, as it's a nice example starting from a continental or a global product to go into higher resolution air quality models. The map that you see here in the middle, there, the points in black are then the official monitoring stations in Poland, where we have a good view locally on the air quality level. The reason you see here then a lot of sensors is because there's a lot of interest in Poland in particulate matter air pollution from residential heating. There's a lot of coal being used, leading in the past to very high pollution levels. And also leading to a lot of interest in using sensors to highlight the need for local action. A lot of groups campaigning for better air quality. And they then run local sensor networks, which are then here all dots, which you are seeing here in red. And what we then do is combine all these data to update a map where we have a first rough assumption. We then have a lot of local data, and you like to update it to a better map, which is mainly highlighting, if you compare left and right, left is showing that we have pollution hotspots, which are the most populated parts. But you see on right, it's a bit more widespread, and also in local communities, we have significantly higher pollution levels than what more rough model outcomes would suggest. How do we do this? We start first a detailed or a more rough model outcome where we try to get an understanding of what is the model uncertainty. And then we try to combine that with the local observations where we use both the official monitoring stations. They might have a rather small uncertainty, and then we have local sensor data. Also there, from a previous study comparison with the monitoring network, we get an understanding of the uncertainty on these data. And then there are some mathematical formulas behind it of how you combine it in a data assimilation scheme to come to an updated map. So in this way, we try to use as many data as possible, and it gives the advantage that you get a much better view locally. At some locations, both your error on your model as well as your observations is high, but using everything together, we try to make the overview as good as possible. With that, I would like to highlight that for air quality, looking at the resolution of what you're modeling and how you're combining it with local data is really important, where the type of modeling scheme that we have set up to look into both real time. We're also going to apply this for forecasting as well as assessment of previous year air quality situation. What we typically start from is background concentrations that you see on the left. There you can use an interpolation model or a global product from CAMS, for example, to get a first view on quite rough what is the air quality situation for a city. And secondly, we try to come with local emission data with the dispersion of the local pollution sources. That can be traffic, industry. It can be bottom-up emission inventories. It can be top-down, and that we use proxy data to downscale these emissions, and then we use a dispersion model. It can be an old-fashioned Gaussian dispersion model. And then you get into, for example, for a city, you see here a highway, here's a highway, you have a local ring road, and you get a better view on what is actually local pollution levels and how is, for example, traffic contributing to this. Lastly, we also throw in a street canyon increment. Why is that important? Because first, without using that, you see most traffic is leading to most polluted locations. Actually, going into higher resolution, we can highlight that you also have high pollution levels in urban environments because of street canyons where you have limited ventilation. There's still significant traffic levels, and because the real urban environments are less well ventilated, there you have pollution levels that can increase to much higher levels. Once you have maps, depending on the resolution that's achievable, we can then combine that with population data to calculate to what are people exposed on an annual level in a region of interest. Here an example for the right is an NO2 concentration map for Belgium. Left you then see a population density map. It's also striking that there's a significant correlation between population data and NO2 levels, but if you overlay them, then you can quite easily calculate the exposure levels. And then from exposures to health impacts, people use what is called dose response curves. Here's some examples where for different diseases, different health endpoints, there's a relation between if pollution levels increase, how is the occurrence of a disease and the amount of deaths attributable to each disease, how is that changing with changing pollution levels. If you pay attention well, then you see that the ones here on the left and the ones on the right are actually the same. The only difference is the concentration range, where this is then for the locations with lower pollution levels, because it's not really a linear relationships. And if we go into higher pollution levels, curves can behave differently. But this also links to the previous presentation that if you would like to apply this, then there's also a need on, for example, respiratory diseases like COPD, how many occurrence of this disease, how many deaths can be attributed to that. You need to combine it with local data, or else you can look at it at a more aggregated level to attribute health impacts from pollution levels. If we then move to how can we then look at actions, what we then also do with the air quality models is we try to model the impact of individual sectors. The way we do that is we just run the model leaving or reducing the emissions from one of these sectors. And in that way, we can come up with not only the maps that we are showing here. This is Ghent, a city in Flanders. And then there is here a web viewer where you can just click on the map, and then it gives you, based on the model outcomes that we have, you can look at the source apportionment over an amount of sectors where we have emission information. And I can look in the city of Ghent what part is attributable to energy production, industry, residential emissions, but also road traffic. And you also have a part, can be a big part, that comes from other regions outside the part that you're modeling. If you look at NO2, then this is about 30% in this situation. If you look at PM, then it's a much bigger part because it's more regional pollution levels. But in this way, we can then look at, if we take local actions, how much impact can we expect and which part of our hotspots can we look at. Which then leads to, for example, for a local urban air quality plan, here an example from the city of Antwerp. We look at a map where you see hotspots. They can be because of tunnel outlets where there's a high concentration of pollution. We have these local street canyons. We have a ring road with a lot of traffic. And then we link it to actions, which we can also model the impact. But important, it also comes down with priority number one is reducing emissions. Locally, we look at other impacts, also greening of the city, designing pollution barriers, changing how traffic is organized. It all has an impact, which are then ingredients that we use in action plans. And then with this last slide, I would like to give an overview of what is then in an action plan for a region like Flanders, where we look at the different sectors. We try to agree with different representatives of these sectors on which actions can be included. And this is then being done for the residential sources, road transport. We also look at agriculture and we look at industry. We start from the point, what is the current situation? Where do we like to go? How much should we reduce emissions? And then for each sector, we are then implementing these emission reduction measures like cleaner use of residential heating sources. For transport, it's both greening of the fleet, electrification of the car fleet, plus making sure that the amount of traffic that we have is not increasing to even higher levels. We limit that. For industry, we of course look at what can we do at the source, what legislation is needed. But in this way, it's a process with stakeholders in all of these sectors to agree on these actions. And then lastly, it's also about implementing the actions and monitoring, are they having the impact that we expect. And with this very last slide, I wanted to highlight, of course, that air quality, it's not a silo that's on its own, but it links to a lot of other sectors where a lot of action is taken, and we can look at it back with at this conference, the SDGs, that it's not only a target for good health and well-being, it's also about making livable cities. It links a lot to climate actions, where in energy sector, industry, if you want to reduce greenhouse gas emissions, it also, the technological choices you make, of course, also impact the local air quality situation. And with that, I would like to end my presentation, and I think we can invite all the speakers in the front.
Yes, so we've only got about 5 minutes, but I'm sure if you don't mind going into your coffee break, you can always stay a minute or two after 11 o'clock. So I'll invite the speakers back. I found it very interesting, especially Nick's presentation on how that the local systems, because I'm also a scientist working in the air quality, and we always have our own ideas how systems pick up about air quality. But it's clear that there are a lot of advancements, I think, already happening on the ground in South Africa, also in Kenya mentioned. I think you recognise that there's still a long way to go. On the other side, we've heard from, should I say, data-rich countries like in Flanders that are maybe a step ahead in terms of the human biomonitoring, as Karen was talking about. Also, as Stan was just talking about in terms of the nice, very high detailed maps that we're showing to really identify where are the hotspots. So I suppose my one or two first questions, I suppose, are to the European speakers of what you've heard also from what's happening in the ground. Where do you think are the quick wins, or where they should start? For example, they don't have that much, maybe lack of data for the models, but is there something we can do? Or in the human biomonitoring, Hamid, what would you suggest is maybe the one or two first steps? Maybe Karen can come in, and then maybe to the African partners from what you presented. Cameron, for example, I think on your last slide you had listed a lot of funders. Karen, you had said in the beginning that you were, I think, with the funding that there were the pharmaceutical industry. So my question there, I was thinking is, how are you going to make it sustainable? Because it's great what's happening. Is there regional cooperation? What you're doing also in South Africa, will it be, anywhere else in outside? And particularly, I think all the work you're doing, Kama, where do you see this going forward, and maybe, how can we help? I think it's a topic, I think, for the whole of G-STIC, is trying to recognize the challenges and where we can actually get the funding to support that. But they're my questions. I don't know if anyone has any questions in the audience. Yes. Don't mind.
Thank you. Maybe I have just two questions. Maybe one is mixed. One is about SACOS, the stations you manage, maybe the quality of data. Can you comment about that? Can you include a layer where you have maybe the guys from K Point assisting you quality control the data? Because it takes a lot of time for us to quality control our own data. I mean, the quality of data in K Point is very high because, of course, it is audited. But I mean, we have to quality control all the data from SACOS before we use. Can you comment about that? Don't you want to include where you have maybe interns or people working in that space? It's been a long time now. This has happened for a long time. Maybe going to Poland. Yeah. Is there any, you have a good time series now of the pollen measurement, 6 years. Have you done any correlation between hospitalization and the time series of pollen? What is the concentration? Is it micrograms per cubic meter? How does the times look like? It would be nice to look at it. Yeah, maybe last. To sort of calculate the pollen air quality index or something like that. How do I classify, for instance, PM 2.5? I can give you different classes and say this is unhealthy for this age group or whatever. Do you have something like that today?
Okay, yep, let's answer.
Can I answer?
Yes.
All right, thank you. Regarding SACWIS, the system currently, there's an auto validation. So things that are obvious, like major outliers, are screened automatically out of the data set. So you as a user, you have opportunity to download the raw data or validated data. The problem comes in the ownership of the network. So if you own a network and your stations are reporting to SACWIS, you as the owner are responsible for the validation of data. So we as South African Weather Service, we don't validate a municipal network data set. They would have to log in and do their validation. So if you're familiar with our country, you will know that we have over 148 reference type monitoring stations. Historically, that's the number we have. But of that quantity, there's probably only 40 or 36 stations that are currently operating how they should be. So the rest are what we call stranded stations that need assistance. So if there is data on the system from a particular station, you would only have access to raw data in the instance where no validation is done. But if you go to the priority area networks, we are responsible for those. You will have the raw data set and you'll have the valid data set. And with the validation, methods vary, but more or less what you're doing should be scientifically, let's say, comparable to what we are doing in terms of validation. We follow a strict process. So you do have that risk. I cannot take it away because all the networks are not owned by us. Until every network owner takes responsibility and manages and provides the data and validates the data, the situation won't change. There have been studies done on the data on SACWIS, and as you point out, data quality and let's say representation is a problem. So we may not always at the stations have more than 70% of data available for whatever period you consider. And we can't control that as a South African Weather Service. As far as the pollen stuff, I think Karen can answer, but it works on counts.
Thanks. I stand corrected here. I'm not an aerobiologist, but we measure pollen grains per cubic meter, which is essentially how much air is sucked in at a certain rate and over the time period that's measured. By all means, have a look on pollencount.co.za. There's got great detail there on how the pollen monitoring is done, how the counting is done, as well as on the SA Cares project. In terms of linking pollen exposure to healthcare and hospitalization, we haven't done that yet, but that is actually in the works as part of the SA Cares study. So we are in conversations at the moment with healthcare providers. So many of the popular insurance companies that you would know to try and access their historical data so that we can, in the areas where we have been monitoring, we can do that correlation. We are also hoping at the moment to partner with SAMRC and look at asthma mortality data. That is the one thing in the public space that we have fairly good data for, is the asthma mortality data, and try and also do the correlation of pollen exposures to mortality data. We have in Cape Town actually one of the longest running pollen monitoring. We have almost 50 years of interrupted data, whereas across the rest of the country, it's been 1 or 2 years sort of ad hoc until SAPNet was set up. So it's a bit tricky to do longitudinal analyses there.
There's also on the solution, like the index, the current technology that we deploying, it does have what you call a misery index part of the solution on your mobile app, but we have not deployed it because we don't have enough stations set up to do that type of forecasting and to provide an indication on the index. But in the US, they call it a misery index. It does come with the the tool MISRI as in MIS, MISRI.
Okay, thank you. Are there any more questions? Yes.
I just have a question for Karen. I'm just wondering, how do you balance the ethics? Because you mentioned that some of the research is funded by pharmaceutical companies. So, like, I'm sure they're looking for a return on investment. So, how do you balance the two? And then for the last presenter, what is street canyons? Just curious.
On the ethics, so this is specifically around the purchase of a Burkhardt sport trap, and they cost about 80,000 Rand for one trap, and then the actual reading of it. So the shipping of the strips to a reader, we do not have that many readers in South Africa. I think we probably have less than 24 across the country. And so the shipping of the strips to them and then for them to read it. And the strips take, depending on how much pollen is in the air, at the moment we're in the pollen season, so there's going to be a lot of pollen. It can take 8 hours to read one strip, to read 1 week of data. So it's a very expensive, labor-intensive process. And the reality is, like, we need the data. And so a few pharmaceutical companies have come to the party and are willing to sponsor that as part of their sort of broader health initiatives. Like CIPLA is one, I think, that's currently sponsoring some of our traps around the country. Yeah, it would be great if it could be a public initiative. It would be great if there was, sustainable funding for that even, because at the moment, again, it's funded for a season, maybe 3 years, and it's an ongoing struggle to get funding for the network.
Yeah, and then about street canyons, what I'm referring to is if you have an example for a highway, is typically an open environment where you don't have a lot of buildings next to a road, where then you have efficient removal of your pollutants by the air that can freely flow. If you then compare that with an urban environment, where in a lot of locations, you have buildings at both sides of a road, the road is much narrower. There you have much more limited ventilation, leading to local recirculation of your air. And then with the same amount of pollution, you get to higher concentrations because it's recirculating, and it takes more time for the pollution to leave the location where it's emitted.
That's the canyon.
Yeah, with a canyon we then refer to, it's kind of the space in between the buildings, and there is a road, then you don't have a lot of ventilation. And that's what we then refer to as a street canyon in the air quality modeling community.
I just have a question for Karen. You mentioned in your introductory slides that I think you said 10 to 15% of South African children have asthma. Is there any data that indicates where they originate from? Which areas in South Africa, towns?
So the data that I'm familiar with is based on a few research studies that have been done over the last sort of 20 years in different areas in South Africa. So a lot of it comes out of KZN, and some of it is from Cape Town in the areas that we're including in our new study, like Masiphumelele and Oudtshoorn. Yeah.
So it's not like urban areas, rural areas.
It's a bit of a mix. It depends on the design of the research study is what communities were included. It's not specifically just cities or just rural areas. There is a mix across the literature. It's just not very much literature.
Okay. I was just wondering if there's maybe a link between where these children originate from and the levels of pollution in those areas.
That's definitely something worth exploring.
Thank you.
Yes, maybe just related to that, I actually also had a question. Maybe you don't need to answer now, but who takes if, for example, you were saying in your presentation about the communities, I mean, pick a certain selection. So if, for example, there's a lot of asthma flares in that area, what is the action then to, say, the air quality community? Or is there any feedback on that they can actually take action, look at the sources? And I was also thinking, Kama, you had mentioned that it's mostly about the pollen, but those strips as well, you said I think they can measure particulate matter. So I was thinking in the future, yeah, maybe it'd be good to be able to link kind of a source contribution and where the source is coming from. So I think maybe that's something good for the future.
Yeah, just to comment on that while you're handing over the microphone. So the research that has been done has linked some causes. So there are things like in areas close to mine dumps, we do see more asthmatics. In kids who live closer to highways, that is in the literature specifically already. We are hoping in this study that we will be able to do that more comprehensive exploration of the things that these kids are exposed to, and really start to understand the difference across communities. In this community that's high and this is low, we saw more exacerbations. Therefore, we think it's an important trigger in our setting. And then to make those recommendations to, I guess, the authorities that are responsible for setting thresholds and putting those regulations in place of what's appropriate in our setting.
Karen, we're seeing projection that boys tend to have higher incidence rate in terms of allergy to pollen than girls. But girls, as they age, their incidence rate also increases. Do you have any explanation for this?
Unfortunately, my answer is I don't know. I'm sure it's in the literature, but unfortunately, that's not an area I'm super familiar with. But definitely worth having a look. I'm sure there's data on that.
I think we can take maybe one quick question. I think this is your fourth one.
My last question. I saw your network when nothing was on the top, but you said most of them. Sorry? Most of the cases of the asthma are in KZN. You don't have measurements there.
So
let me pause and ask one question where you can answer that just before. I just wanted to ask about your 7.5p. It's a column density. I mean, you are generating a very good data, but of course, you want it to be very high quality. It's most per kilometer column density. It could be used very well, but to do any processing, maybe to bring it to the ground, or maybe bring it to units that you can use like micrograms per kilometer, where you can sort of get a level of pollution. And maybe last question is could you comment about local centers? Do you have anyone you can suggest the best one we can use? We here in South Africa or Africa seem to think that this could be a solution, and you guys are testing a lot of local centers. You also compare them and test them. Do you have any suggestions of some of the local centers we can maybe look at for equality? Thank you.
Okay, I think we'll take about maybe 2 or 3 minutes to answer these two questions, if that's okay with the audience, for your tea and coffee, and then I think we'll close it off then. And we're available for any comments in the tea and coffee later on. So
just a quick response. As a social scientist, I know little about what the engineers are doing in terms of the modeling and the use of satellite data. But what we try to do is to have broader different kind of data sets that can then be modeled into the early warning system, of which the human sensor network, so the citizen science network, is one. But so satellite data is also one, because we depend on these low-cost sensors produced by Census Africa. And we have one reference grade monitor at the meteorological department. But so it's to get as much coverage as possible and then link that to the citizen science data, either as a kind of feedback loop. If we get a reading in a certain neighborhood, we send citizen science ambassadors there to check, okay, what is going on? Do a coding yourself, of the potential pollution sources that could contribute to the reading. But so all of these data sets should contribute to a more rich interpretation of what is going on, and the satellite data is one of them.
Okay, about which is the best sensor. I'm not going to drop a name, but there has recently been a project in Flanders where they did an intercomparison of a lot of sensors and measured how they perform in the lab, also in the field. And I can share the project website, and then you can make your analysis as well.
okay, I'd like to thank the speakers again for your contributions. It was very interesting. Thanks a lot.